The purpose of this class is to introduce you to the Kawai style of acupuncture. People often ask me to teach Kawai style, and I often refuse because it involves a lot of equipment which is both expensive and hard to get. So it asks for a very large commitment from students who are taking the class. This online presentation, I hope, allows people to taste and to see what the style is like, and then you can decide to get the equipment or take further classes if you wish. I believe this serves the exposition and preservation of the possibilities Kawai explored much better than the current situation of limited classes and unavailable information. Because of the nature of this style, which is very hands-on and unusual and requiring what I call toys, or different kinds of equipment, it is a theoretical presentation is not enough. One needs to see exactly how it's done. Because of that, I interspersed short demonstration videos through this presentation. But please bear in mind that what you're seeing are just snippets of treatments, just small sections of a treatment, not taking into consideration everything else. You're just looking at how to apply something technically in a pretty limited context. But I hope it still gives you ways to implement this style. Yoshihiro Kawai was part of the Monaco topology group, and he is famous for expanding the use of ion pumping technology. Throughout the 1990s, I learned about Kawai style through Kiiko Matsumoto, and in 2000, Kiiko and I brought Kawai to teach in North America as well. Kawai was an emissary. He was an acupuncture cultural exchange type person. He studied for many years in both China and Korea, as well as in Japan. His acupuncture style does not look like the standard Japanese styles that we're used to seeing. He likes thicker needles. He prefers 1.5-inch needles, number 8 or .30 gauge. This, by comparison to the number 1 gauge needle, probably the most commonly used one in Japanese styles, which is .16, is basically twice as thick as what we think of as Japanese style needles. He would use a 1-inch guide tube with a 1.5-inch needle. So obviously we're not talking about the shallow insertion we associate with most Japanese styles. However, the incredible thing was that you really did not feel the needles at all. The depth of insertion, the more depth of insertion and longer needles, thicker needles, was necessary because for Kawai, every needle means moxa, kyutoshin. Even if it is a scalp needle or an ear needle, it still gets moxa over it. And needle is never inserted alone for Kawai. It is always receiving moxa. This is consistent with the name Jianjiu. Jian is needle, and Jiu is moxibustion, or literally weighted by fire. The needle is put on fire, carrying the extra load of the heat. Acupuncture implies moxibustion. I personally do not practice the way Kawai did. I choose to use his local treatments with the use of the so-called toys, and I opt for remote needles or root treatments using a different style of thinking, partly because I am unwilling to utilize so much moxa. I do use Okyu, direct grain moxa, which has no smell, but I do not use Kyotoshin, which leaves the treatment room smelling like a smoking den, even with an air filter. Because of that, I had to be selective as to what I can utilize from Kawai. At the end of this presentation, I will explain, to the best of my ability, some of the ways Kawai treated people as root treatments. But most of this presentation is about the use of diode rings, chains, 3 bypass cords, pachi-pachi, aluminum foil, etc., which I use clinically all the time. There are also some special points that Kawai utilizes for certain conditions, which I also use. But on the whole, Kawai's fame is based more on his inventions and use of technology than on his use of points. Let's introduce the players, or the toys. The ion pumping cords, or what we call regular ion pumping cords, are a copper electrical conducting wire with 2 clips, a red and black clip. There is a diode at the end of the cords so that the flow of electrons is allowed in one direction only, creating a polarity. The cord acts in such a way as to pull positive ions away from the black clip. Their original use was to pump ions away from burns and later inflammation. Manaka discovered that by covering wounds with tin foil, the wounds healed faster, and he attributed that to the foil's ability to pull away positive ions. To increase that capacity, he invented the ion pumping cord. So the black clip is connected to the foil, and the red clip is connected to a remote point, aiding in the pumping of positive ions away from the site of the tin foil. Later, Manaka used the cords on the opening points of the 8 extraordinary meridian pairs. This is the original basis of much of Kawai's work also. However, the Kawai style of ion pumping cords is different than Manaka's, as it tends to cross the body. Kawai also uses ion pumping cords on wrist and ankle pair points. In the Kawai style, the ion pumping cords can be used on needles or they can be taped on the skin. The 3 bypass cord has 3 clips, a red clip, a green clip, and a black clip. There are 2 diodes involved here, creating a circular rather than a linear movement of ions. With the regular ion pumping cords, the pumping of the body's own electric charges happens automatically because there is one diode, therefore one direction. And since there's always a natural differential grade between different areas of the body, if an ion pumping cord is connected to a metal or a foil that is touching the upper dermis, there's always a differential charge and the cord will stop pumping automatically. With the 3 bypass cord, because there are 2 diodes, the movement of the ions needs to be initiated. It doesn't use the natural grade that happens because there's more than two areas involved. And this is the role of the pachi-pachi. It sends an initial spark through the cord. Once that initial spark was created, the pumping continues and the direction is determined by the diodes inside, red and green clips. The pachi-pachi, which is also known as the Panasparker, as it was originally produced by Panasonic, it was originally a modified oven sparker used to stimulate Jingwell points. The spark in the front of the pachi is accompanied by an electrical impulse to the back screw of the pachi. The black clip of the 3 bypass cord is attached to the back of the pachi. Then the spark at the front is touching a needle or foil that is touching the body. Thus the pachi becomes for a moment part of the circuitry. And once the spark has been initiated, the black clip is then removed from the back of the pachi and placed on the body, either on the needle or on the foil, and the pumping is continued. On the left, you're seeing what we call the pink pachi, which is the pachi, the original pachi, and you can see it says National at the bottom of it in the back. And the black pachi that you're seeing on the right-hand side is the pachi that David Yuen currently sells. They are, in my opinion, slightly different, but most people say that they operate pretty much in the same way in terms of results. Occasionally, I find that I do prefer the pink pachi. There are many treatments where the clips are placed on needles and the sparking is done on a needle. In these treatments, the patient feels quite a strong electrical feeling. Kawai, however, was able to spark patients and avoid any uncomfortable feelings, just as he was able to do with needles. But I have not met anyone else who has been able to do the same. Because of that strong and unpleasant sensation, I tend to use those treatments with needles and 3 bypass cord and Apache less frequently. There are also other treatments where the red and green clips are attached to a diode ring or a chain on the body, and the sparking is done onto aluminum foil or sometimes onto a needle. Then the black clip is then attached to the foil or that needle. Sparking foil is much milder than sparking a needle, and therefore I tend to use these treatments a lot more than the pure needle ones. Remember that the pachi is used always with a black clip attached to the back, sparked, then the black clip is removed from the back of the pachi and attached to the body, clipped either onto a needle or a foil. The pachi does not stay with the patient, only the cord does. That means that you only need one pachi no matter how many patients you treat or how many cords you use at the same time. It is advised to spark every 10 minutes for a total of 3 times, meaning at the beginning, after 10 minutes, and after 20 minutes just before you take the needles out. The diode rings are diodes that are mounted onto copper rings. They initiate movement in the meridians. Used on the fingers, they activate the well of the meridians, the source, where the energy is most volatile, like a spring head of a river. The copper rings seem to work best on fingers. The rings can also be taped on the body. They pull out inflammation, and that action can be enhanced by the use of the 3 bypass cord, aluminum foil, and pachi. But you don't have to use those, and you can just tape the rings on, except it will take a lot longer. The rings will have to be taped on longer. These rings are especially good for bone and ligament issues, as well as for bruises and inflammation. I prefer the gold-plated rings on the body, and I prefer the copper rings for fingers. Although one can use one ring only, the rings are always sold as a pair, never singly. There are 2 colors of the rings, red and green, although originally they were red and blue. The red is considered more tonifying, and the green reducing. This plays a role on the left little finger, which always gets red, and on the right thumb, which will get red if it is liver deficiency or green if it is liver excess. When taped on the body, green is generally placed on the most painful spot, and red is either used for numbness or on a less painful spot. No more than 2 rings are placed on each hand, a total of 4 rings at any one time on the hands, with each hand having opposite colored rings. If you're using 2 rings on the left hand, they should be of a different color. And if you're using the same finger on both hands, each hand on that finger will have a different color ring on it. The diode chains are silver chains with diodes soldered onto the chain, interspersed as red facing green every 6 centimeters. This optimizes the flow in the area surrounded by the chain. Kawai prefers stainless steel chains, but the ones being sold currently are silver ones. Chains are used on joints where they can surround the joint, for example wrist, ankles, knees, as well as the neck, or on the body where the target, the inflamed area, is too large for 1 or 2 rings, for example multiple spinal disc problems or a large scar. The F3 pointer is an electric stim machine that has different settings, including the stimulation of magnets. I use the F3 pointer for stimulation of magnets that are taped on the body. This is very good for bone issues. However, Kawai uses the F3 pointer as a regular electric stim machine on needles. He would stimulate needles that have 3 bypass cords attached to them and forgo sparking that cord with a pachi-pachi at times, because the F3 stimulation already moves the ions. David Euler, in Kiiko's Clinical Strategies books, warns against the use of electric stimulation of ion pumping cords, as it may destroy the diodes. It is possible that the setting of the F3 pointer is such that it prevents that, and it is also possible that the 3 bypass cord can take electrical stimulation, whereas the regular ion pumping cords cannot. I do not know the answer to that, as I have not used any other electric stim machine besides the F3 pointer, and I also do not use it with needles and cords, but rather with magnets only. The F3 pointer became unavailable quite a few years ago, but recently there have been some attempts to revive it, and a few units became available. The cost is quite high, and for a while it became unavailable, but I understand that another F3 replacement machine has just been created and is available, at least for right now. At the end of this presentation, I will give you resources where you can get these equipments. The Hibiki 7 was an ear point locator and stimulator. Kawai used it both as a measuring tool and for treatments. The thyroid neck treatment with a chain, foil, and Hibiki 7 is especially effective. Although the Hibiki 7 is no longer available, I am including some of the treatments that utilize it because they're quite effective. It is my hope that in the future someone will be inspired and might be able to find a similar machine that already exists or build a similar machine so that those who did not have the opportunity to get a Hibiki 7 set 20 years ago will be able to utilize its effectiveness. I understand that a new Hibiki 7 type machine is now available, and again at the end of the presentation I list all resources for all the toys. Kawai also measures the conductivity of all the Jingwell points before treatment as a way of assessing the weak and overactive meridians. However, it was never clear to me that this influenced his treatment choices. At the end of the treatment, he might remeasure the conductivity of the Jingwell points as a way of confirming the effectiveness of the treatment. I have not utilized this myself. The aluminum foil is used over a chain or diode rings, with the red and green clips of the 3 bypass cord attached to the rings or the chain. The foil is then used to cover the area and taped to the skin. It is important that the foil is touching the skin. The black clip is attached to the back of the pachi and the foil is sparked. The black clip is then attached to the foil. The sparking can also be done on a remote point, and the black clip can be attached to that remote point. In the same manner, you can use the Hibiki 7 or some similar substitute stimulator with a black clip on the chain or rings covered with foil and stimulate the appropriate ear point for the location or the problem for 7 seconds. I often use both the 3 bypass cord and the Hibiki 7 at the same time. It seems not to matter which side of the foil faces the skin. The foil I use is regular by American standards and not heavy-duty foil, which is too thick. In some countries, the regular foil is very thin and tears easily. It is similar to the foil used in some burrito places in the United States. This foil is not as good as the so-called regular, which is not too thick, it easily conforms to the body contours, and it doesn't tear easily. The infinity treatments are root treatments with regular iron pumping cords. In the Manaka style, cords do not cross the body, and sometimes you find that the patient feels aggravated by the treatment. To counteract this, Kawai came up with the infinity treatments, where each cord crosses the body from left to right. The red clip of each cord is always placed on the left side. The infinity treatment is called that because it traces an infinity symbol, or an H shape, on the body, going from the left arm to the right leg with the first cord, and then from the left leg to the right arm with the second cord. The infinity symbol is made when we think of continuing the flow between the feet and above the head. I originally learned these treatments without the use of needles and with the clips being taped on the skin, and the red clips then being stimulated with a pachi to get the flow of iron started. Some people use the same treatment with needles and without the pachi. I like these treatments especially for people with unclear symptoms and who find it hard to say if a treatment point is helpful or not. These are often autonomic nervous system types, and those people who dislike needles. These treatments allow me to accomplish a fair amount of clearing and movement with relatively subtle manipulation and allow for some points to then be needled as necessary to add further effects. So here we see the Wei treatment, sparking the red needles on the left side and gallbladder 41 on the left side. There are two main infinitive treatments. The Chow Chow treatment, which utilizes lung 7, kidney 6, UB62, and small intestine 3, and the Wei treatment, which uses pericardium 6, spleen 4, gallbladder 41, and Sanjiao 5. The purple cord in this drawing is called the yin line. One ion pumping cord is placed on the left hand and receives the red clip on the yin opening point, which will be lung 7 or pericardium 6. And the black clip of that cord is attached to the right foot on the correlated yin opening point, kidney 6 or spleen 4. This is called the yin line and is considered the major line. It crosses from the left side down to the right, going through the heart, the big fire on the left, through Mingmen, the small fire on the right. The second ion pumping cord, the yellow line in this diagram, is placed on the left foot, which receives the red clip on the yang opening point, UB62 or gallbladder 41, and the black clip of that cord is attached to the right hand on the correlated yang opening point, small intestine 3 or Sanjiao 5. This line is the yang line, crossing from the bottom left to the top right. The yin line, going from the top left corner with the arms up to the bottom right, connecting to the yang line between the feet, continuing from the bottom left to the top right, and then connecting above the head to the starting point on the left hand, creating an infinity or a figure 8 symbol with the torso in the center. All 4 clips are taped to the skin at the points, and then the red clips, which are on the left side only, are sparked with a pachi. The patient may feel the spark either on the left side where you're sparking or on the opposite side, on the opposite limb on the right side where the black clip is attached. The Chow Chow treatment uses lung 7 on the left with a red clip, connected to kidney 6 on the right, which gets the black clip. Note that I use lung 7 in line with the channel. The other ion pumping cord, the yang line, starts with a red clip on UB62 and connects to right side small intestine 3. Very clear on the drawing here. The indications for Chow Chow treatments are symptoms below the diaphragm, such as colitis, PMS, and other menstrual issues, prostatitis, bladder infections, etc. The patient may show pressure pain on lung 1, kidney 16, and Ren line around and below the navel. This is somewhat similar to the Manaka diagnosis of Yin Chow. There is an older style diagnosis, which involves checking for pressure pain on the back between the scapula. If pressure pain is found at the level of T3, that is the line of the lung shoe or outside the lung shoe, UB13 and 42, and there is no pressure pain below at the level of T4 and 5, that's the heart and pericardium shoes, this is considered to be a Chow Chow indication. If pressure pain is found at T4 or T5 levels, that is heart or pericardium shoe or outside UB14, 43, UB15, 44 levels, but not at the T3 level, this is considered Wei indications. At that time, it used to be claimed that 80% of all people fall into one or the other of these two categories, that is, pressure pain at T3 level or pressure pain at T4 or 5 level. I find that this is not quite so uncomplicated as we might like it to be, and I noticed also that Kawai actually did not use this diagnostic method either. Generally, the guidelines will be either by the symptoms or above the chest, below the chest. Below the chest for chow chow, abdominal symptoms, chow chow, and chest symptoms will be wei wei. That will be the sort of quick and easy way to choose between the two. For intestinal problems, you can vary the yang line and use left stomach 41 with a red clip and right large intestine 4 with a black clip. The yin line stays the same, which is left lung 7 with a red clip connected to right kidney 6, which gets the black clip. The wei wei treatment uses pericardium 6 on the left with a red clip connected to spleen 4 on the right, which gets the black clip. The yang line starts with a red clip on left gallbladder 41 and connects to right sanja 5, which gets the black clip of that cord. You can use the textbook gallbladder 41, or you can use a point that is puffy between gallbladder 40 and 41. The wei wei treatment is used for symptoms above the diaphragm or the chest, such as angina, anemia, blood pressure imbalances, chest distress, etc. It is a common treatment for cardiac patients and autonomic nervous system type disorders. The patient may show pressure pain on REN 17 or stomach 30. Stomach 30 here represents the irrigation of the pectoral zongqi. You can also use the older style diagnosis of pressure pain at levels of T4, T5 if there is clear pressure pain at that level and not at the T3 level between the scapula. For hepatitis, replace the right spleen 4 with liver 3. This is a modification of wei wei modifying the yin line. Use this also for chemoradiation and leukemia, and also then needle the Nagano liver excess treatment points, which are right kidney 7, right spleen 7, right heart 3, right pericardium 4, 3 fingers below pericardium 3. For some patients, the Manuka liver treatment is preferred to this one. This is a one-core treatment with needles, using large intestine 4 on the right side with a black clip connected to left liver 3, receiving the red clip. As far as I know, this is the only Manuka treatment that crosses across the body. I may be wrong on that. For diabetes, use the wei wei line of left pericardium 6 to right spleen 4, but vary the yang line to left stomach 41 receiving the red, connected with the same cord to right large intestine 4, which receives the black. If you wish to use the 3 bypass cord rather than the ion pumping cords, use needles on all 4 points. Place the red clip on the left hand needle, the green clip of the 3 bypass cord on the right hand. Spark and place the black clip on either one of the leg points, the left or the right. I personally do not use this treatment option because, unlike Kawai, my patients are not all that appreciative of the sparking of needles. Kawai, I have seen Kawai use this variation. If an infinity treatment is clearly the best part of the treatment for a patient, you can tape magnets for continued home use of them. Use the yin points only, that is the left hand and the right foot. The north facing the skin magnet is just distal to the point, and the south facing just proximal to the point. That means that the south magnet, south towards the skin, is always closer to the torso, meaning the flow is always towards the torso, whether it's the foot or the leg. This creates a flow across the yin line towards the center. In the case of chow chow treatments with magnets, place the north magnet just in front of kidney 6 and place the south just behind it, slightly towards the Achilles tendon. I use lung 7, again north magnet just below, slightly towards the thumb, and the south just above. Kawai also had a universal infinity treatment. Originally, this treatment was done with specialized magnets. However, a set of these 4 magnets was about $1,000, so this treatment can also be used with magnetic diode rings. The Kawai magnets are basically modified magnets. They have a strong side and they have a weak side. The strong side attracts each other. The strong and the weak attract also. Weak against weak does not do anything. It does not repel, does not attract. So these are specialized magnets. The magnet is taped always strong side facing the string. Strong side facing the skin. Strong side goes on left pericardium 6. Then strong side of a second magnet goes on right spleen 6. This is the yin line, even though there's no cord between them. Now, another strong side facing the skin goes on gallbladder 39. As soon as I get that tape untangled. So gallbladder 39 on the left side, and Sanja 5 on the right side, that constitutes the yang line, gets a strong side magnet. So always facing the skin is the strong side. Since most of us do not have these specialized magnets, fancy magnets, you can use a green diode ring on pericardium 6, a green diode ring on right spleen 6, a red diode ring on right gallbladder 39, and a red diode ring on right Sanja 5. If you're using the magnets, the treatment is complete in 3 minutes. If you're using the diode rings, left pericardium 6 with green, magnetized diode ring, right spleen 6, magnetized green diode ring, left gallbladder 39, red diode ring, and right Sanja 5, red diode ring. That treatment requires 30 minutes for completion. And Kawai said you can only use the magnetized diode rings. He said the copper diode rings do not do the same thing. The universal infinity treatment is used for morning sickness, for intestinal and stomach problems, for back pain, for needle-phobic or non-responsive patients, as well as for back pain, and have the patients move while the magnets or the rings are taped on. Kawai also had ion pumping cords for non-root treatments that are for specific symptoms, using just one cord. These are very useful and can also be used with needles only, or with needles and then a cord on it. In other words, you can just use those points, or you can use the points and then clip the cords on them. These are not treatments that are done with the cord taped on. Okay, so stomach 41 and spleen 5 is the combination used for knee pain. It is probably one of the most useful combinations for knee pain. If you're adding a cord, the black clip is attached to the needle on stomach 41, and the red clip goes on spleen 5. Both points are used on the same side as the knee pain. This combination is also used for ankle problems, gout, old sprains, and lateral ankle problems. So here is spleen 5 and stomach 41. Liver 3 and gallbladder 41 is a combination used for sciatica, especially if there's also inguinal pressure pain. It is also used for back pain and ankle sprains. The black clip goes on liver 3 and the red clip goes on gallbladder 41. Again, use the points on the side of the pain. Kidney 6 and UB62 is a very good combination for pain in the sacrum. If the pain is on one side, use kidney 6 and UB62 on that side. If the pain is central and affects both sides, use both sides of the ankle points. This combination can also be used for calf pain, heavy, swollen or tired legs, and can help manipulate the gait in cases of back pain. With an ion pumping cord, kidney 6 receives the black clip, while UB62 receives the red clip. For shoulder pain, you can try the yin-yang combinations at the wrist. It may require more than one combination. On the wrist, the yang point receives the black clip and the yin point receives the red clip. Hold the 2 points and vibrate them with your fingers as the patient moves the arm to test the shoulder. You need to move with them, of course, while maintaining the vibration. With the wrist points, I find that the ion pumping cords actually do more than they do in the ankles. So I often forego the ion pumping cords on the ankles, but I tend to add them on the wrists. Large intestine 5 with lung 9 tends to do a good job for pain moving the arm back, meaning stretching the pectoralis. Sanja 4 and pericardium 7 tends to do a good job when there's pain moving the arm across to the front. Notice that we take Sanja 5 in the center and not on the lateral side as many TCM texts have it. Small intestine 5 and heart 7 is the third combination that's worth testing. The 3 bypass cord has 2 diodes and circulates the ions in a triangle or circle, unlike the regular ion pumping cord, which has 1 diode and moves it in one linear direction. The green clip of the 3 bypass cord is more dispersing and is placed on the more painful area. The red clip is considered more tonifying and will be placed on a supporting point. Positive ions are supposed to circulate from the green clip to the black clip and from the black clip to the red clip. When you spark, Kawai said that you can retain the needles for just a few seconds, and that would be enough, although I've never tried it. Normally, I leave the needles for 15 minutes, even though I spark them. Kawai would often place 3 bypass cords on needles that were also clipped onto the F3 pointer, so they also received electrical stimulation, and thus he would not have to spark the 3 bypass cord. Here we see a triangle created by both sides of UB35 receiving the green clip and the red clip, and the third part of the triangle is L5. The black clip goes on the back of the pachi. L5 is being sparked, and then the black clip goes on the back of the pachi. So this is the general flow of using 3 bypass cord. You place the green clip, the red clip, take the black clip onto the back of the pachi, spark, and then place the black clip on the needle that you sparked. One bypass cord can be used only on one side on the arms or the chest. It should not cross the chest. Each 3 bypass cord creates a triangle. You can use more than 1 triangle at a time, and Kawai often used as many as 4 or 5. But a triangle that is above the diaphragm should not cross sides. Above the diaphragm creates a triangle on each side. This does not hold true for the face of the neck or to areas below the diaphragm, only to the chest itself. Also, do not spark needles on the chest or on arms in cardiac patients. You can use ring or chain treatments with aluminum foil, but not needle treatments with sparking. Below the diaphragm, or on the head or face, 1 triangle can encompass both sides, and we would tend to place the black clip on the center, on the spine, with the green clip on one side and the red clip on another. Place the green and red clips on the needles and the black clip on the back of the pachi. Spark the black needle and then place the black clip on that needle. The black clip tends to go either on the center or on a needle that resolves the problem. The green might go on the problem spot, for example a scar or the most painful spot, and the red goes on the supportive area or the somewhat less painful spot of the problem area. These are just guidelines. I have seen Kawai use weird combinations of 3 bypass cords. It is almost as if all he really wants to do is to move the energy around. Let's continue with some protocols which I have found to be quite effective, and the placement of the clips is going to be clearly described. For neuropathies that are the result of diabetes, after the front treatment, use this 3 bypass cord treatment with needles. First, find the border between the numb area and the normal area and the numb area. This can be on the calf or it can be on the foot. Along the border, find the painful spot. This is called the border point. If you cannot find a painful spot, look for a gummy spot or anything unusual along the border. Needle T11, T12, Huato at a 45-degree angle towards the spine. This is the sugar point. Needle UB42 towards the scapula. This is to supply oxygen into the blood. Needle Yao Yun, the lumbar eye, the dimple on the posterior iliac crest towards the leg. That is down and slightly out. This is considered blood supply to the leg. In neuropathy, we want to reduce the glucose content of the blood, increase the oxygen, and create more flow of blood. Needle the border area. Now, you're going to create a triangle in each side. Each side gets its own cord. So, on the worst side of the neuropathy, place the black clip on T11, T12, the sugar point. The green clip is going to go on the border point. And the red clip goes on Yao Yan, the blood supply to the legs. On the side that is not as bad with the neuropathy, place the black clip on T11, T12. The border on this side is going to get the red clip, and Yao Yan on this side gets the green clip. Notice that this is creating one triangle on each side, not crossing side. So take the black clip of one side, cord of one side, place it on the back of the pachi, spark UB42 on that side, spark T11, T12 on that side, and now place the black clip from the pachi onto the needle. Now, moving on to the other side, take the black clip, put it on the back of the pachi, spark UB42 oxygen supply, spark T11, T12 sugar point, place the black clip on T11, T12, and you can ionize the air above it. So, according to Kawai, you can also needle the points behind the toes, at the base of the toes, where they meet the ball of the foot. That is 5 points, and spark those as well. But I have found this part to be rather unpleasant for patients, and that I can actually get away without adding that and still get decent results. For diabetic neuropathy, this treatment with the needles and the 3 bypass cord is the best treatment. For non-diabetic neuropathy, this treatment is not so useful, and the aluminum foil treatment is far superior than this one. However, for diabetic neuropathy, we do need this treatment. If you do have a lot of patients with diabetic neuropathy, notice that the border point is below the knee, and the cord needs to reach from the border point between the numbness and the regular area, and T11, T12, and actually it needs to reach all the way to UB42. So you do need long cords for this treatment. And I do add the aluminum foil treatment for diabetic neuropathy patients. On the front, I do the chain with aluminum foil treatment on them, and that treatment is going to be described later. The basic treatment for stroke uses 3 needles in a scalp. Do 20, which gets the black clip. 1/3 down from do 20 towards the apex of the ear, which receives either a red clip or a green clip. And 2/3 from do 20 to the apex of the ear, which receives the other clip, either red or green, depending on what the one above it got. Kawai said to treat both sides of the scalp. The affected brain side is the treatment side, while the other side is done for prevention. So on the other side, so here we're seeing the left side, and do 20 got the black. The red went 1/3 below, and green went 2/3 below. On the right side, you would do a similar triangle. The black clip will still go on do 20, so do 20 actually gets 2 clips of 2 different cords. The point 1/3 below it will get a green clip because on the side we're seeing it's red. So opposite side of it, same point, opposite side should have opposite color. And the point 2/3 below will get the red clip of that cord. Then on the body, on the affected side of the body, which is opposite of the affected brain side, so in this case, say it will be on the right side, needle large intestine 4 or the immune point, and on the leg needle UB58. Take the black clip, put it in back of the pachi, and spark the arm and leg needles, and then spark do 20. Alternatively, you can, instead of using the line between do 20 and the apex of the ear, you can use the line between do 20 and tai yang, and then divide that line into 4. The top quarter is the lower limb, the middle is the upper limb, and the lower quarter is the speech area. You can needle all of these, but when you place the 3 bypass clips on these areas, place them on the areas that correspond to the most affected loss of function, and recall you now have 4 needles, do 20 plus upper limb, lower limb, and speech area, but you really only, the do 20 gets the black, and you only have a green and red clip left between the 2 needles, so you need to choose which needles you're going to put the clips on if you needled all 4 points. Okay. Always look for big dents and give those preferences in needling, as well as mushy, spots, or soft bumps. This treatment is also used for Parkinson's patients with the addition of do 20 on UB3. My personal experience with this treatment is only with patients who are out of rehab, meaning not fresh strokes. I find that it is quite effective in helping restore function, but as the patient is more elderly, the effectiveness is being lessened, with more quick, dramatic, positive results in patients below age 80, and quite slow progress with patients in their late 80s, or early 90s. For patients who come with dropped foot or with clenched fists, often years after the stroke, this is the treatment that I use. For the leg, for dropped foot, find stomach 36 or gallbladder 34, and find the spot that when you press on it, it makes the foot jump. Perhaps very slightly, but it makes the foot jump. This is the point that you're going to needle, and this is the point that will get the black clip. Needle liver 3, and that receives the green clip. Needle gallbladder 41, and put the red clip on it. Take the black clip of the pachi and of the 3 bypass cord connected to the back of the pachi, and spark either stomach 36 or gallbladder 34, the place where it made the foot jump. Now, as you spark this needle, the foot should jump a fair amount. This is the desired outcome. And place the black clip on that needle. You can then spark every 10 minutes or so. For the clenched fist type, find the point that activates the hand, either somewhere above large intestine 10, the immune point area, or Sanjiao 8, about 1/3 down from the elbow. This point receives the black clip. Sanjiao 3 receives the green clip. The medial Yao Tong Shui, between the 2nd and 3rd carpals, receives the red clip. Also, needle large intestine 4. Spark the immune point or Sanjiao 8. You're looking for the hand to get activated and open for a moment with a spark, and then place the black clip on that point. This is an extremely useful treatment and can work on people who have been unable to open their hands for decades after a stroke. After this treatment, while I do the back treatment on people like that, I add the chain and aluminum foil treatment on the hands, just like, say, sprained ankle or neuropathy. Okay? So let's look at these treatments. Bear in mind that these are demonstrations only. The model here did not have a stroke, and his arms and leg are functioning totally. Therefore, I'm not able to show you how to find the point below the elbow, the immunosanjiao 8, or below the knee that makes that limb jump. So here we're seeing the arm. Large intestine 10 is the place that supposedly made the arm jump when I pressed in it. Sanjiao 3 with green, Yao Tongshui with red, spark large intestine 4. Now spark the immune point, and you can see that there's a little jump in the hand, even though he didn't have a stroke. Now take the black clip and put it on large intestine 10. Looking at the leg, so you see liver 3 already needled and has the green clip. Gallbladder 41 has the red clip. In this case, I chose stomach just below stomach 36. Could have chosen gallbladder 34. So now we take the black clip, goes to the back of the pachi, spark stomach 36, and you see that the foot got jumpy, and that's pretty much what you want. For post-stroke hemiplegia, you can also tape diode rings on the limb and then move the limb with the rings on it. So on the hand, you take a green magnetized diode ring and tape it on pericardium 8. You take a red magnetized diode ring and tape that on large intestine 10, large intestine 11 area, immune point area. For the leg, you will use a ring diode ring on gallbladder 34 and a red diode ring on kidney 1. And then you move the limb, or if the patient can move their own hand or fist or whatever, they move it so as to activate the magnetic diodes and activate their own magnetic field. For epilepsy or Parkinson's, Kawai uses DO20 plus UB3. The point at the hairline above UB2 is used for any coordination issues, shaking, depression, and mood swings. This is done with one triangle, DO20 getting the black, and one side of UB3 gets the green clip and the other side gets the red clip. To this treatment, you can also add the line between DO20 and the ear. The Ren-Do miscommunication treatment is the basic treatment for any issue in the face, the eyes, the ears, TMJ, sinuses, etc. I use it primarily for sinus issues, often modifying it by replacing DO20 with DO23 or 24. This treatment uses two needles. One is on DO20 and one is on Ren22. The line between these 2 points crosses the nasal cavities, and the idea is that it affects the whole face. This is also where the Ren and Do meet, and therefore this is where the name of this treatment was taken. So, DO20 receives 2 clips, the red clip and the green clip. It is better to needle DO20 towards the nose so that those two clips do not bend it. The black clip goes on the back of the pachi. Ren22 is being sparked. The black clip taken off the pachi and placed on Ren22. Now you can spark the air above it to ionize it. Most patients will complain of a mild, unpleasant sensation with the sparking. Remember that DO20 receives 2 clips, the red and the green clip. This is a little bit unusual with 3 bypass cords. I often use DO23 or DO24 for nose issues instead of DO20, and then I add 2 diode rings, one on each side on large intestine 20 area. And I basically find the most painful spot around large intestine 20 and tape a diode ring on it. I connect the rings to the red and green clips of the second cord, 1 clip on each side. I spark with that cord DO23 or 24, and either leave the black clip on DO24 or just disconnect this cord altogether, having sparked it once, and leaving the Ren-Do miscommunication triangle going. The sparking with rings on the sinuses is really quite intense. Let's look at what that looks like. So here the black clip of the pachi of the 3 bypass cord goes on the back of the pachi. Ren22 is sparked. This is for the Ren-Do miscommunication, which I did with DO24. Red and green clips are already on DO24. I have a green diode ring on the patient's left side, so I place a red clip of the 3 bypass cord on it. The red ring is on the right side, so it gets a green clip. The black clip of that cord goes on the back of the pachi. I'm sparking do 2324. Here I spark Ren 22 as well, which is not really necessary. And I'm choosing to leave the clip on. Kawai was most famous for his treatments of ears. Especially, he treated children who were born deaf. With this treatment, Kawai said that he was able to treat deaf children so that after a year, 1/3 of them could hear well enough to attend regular school, 1/3 could hear something but not quite enough to go to a regular school, and 1/3 experienced no hearing still after a year of treatments. These are truly remarkable results. I myself also had the experience, with adult patients though, of restoring hearing with this treatment. It is clearly a great jewel. Palpate gallbladder 2, small intestine 19, and Sanjiao 21. Needle the 2 most sore spots of these 3. If you can't distinguish between the 3 which is the most sore, just needle gallbladder 2 and Sanjiao 21. Place the green clip on the sorest point and the red clip on the other, or just put one on gallbladder 2 and one on small intestine Sanjiao 21. Needle the Kawai eustachian tube point on the back of the ear. This point is also called yang linking in the Shanghai ear map. It is located in the depression under the tendon that pops up when the ear is folded forward. It is neither an ear point nor a skull point. It is sort of in between. On some people, there's a bunch of tendons that pop up. Take the lowest one. This point is needled at a 45-degree angle, in and up. You might think of it as if it's pointing towards yin tang. Spark the Kawai eustachian tube point and place the black clip on it. This can be done on both sides at the same time, each side being done with its own cord. This is the treatment for all ear issues, from hearing to congested ears. The Kawai eustachian tube point is used not just for ears, but also for any neck or thyroid issues as well. Because it releases the neck and affects the thyroid for both hypo and hyperthyroid, it by extension smooths the autonomic nervous system. Although Kawai is not known so much for the use of unusual points, this is a major point that is worth including in our repertoire. For tinnitus, rather than a needle treatment, use 2 diode rings and an aluminum foil. The rings are placed over the earlobes so that they are pointing color to color towards the back of the Kawai ear point. The red and green clips of the 3 bypass cords are attached, one to each ring. The ear is now covered with aluminum foil, which needs to touch fully and tightly. The black clip is placed on the back of the pachi, and the foil is sparked. The patient usually feels very little, nothing often, or they may have a mild sensation as if the foil is tingling them. The black clip is then placed on the foil. Let's look at that treatment. So, a diode ring, the red one in this case, is placed at the top, and the color is pointing towards the Kawai ear point in the back. Another ring, again color, going towards the Kawai ear point. Now, we place the red clip on the green diode ring and the green clip on the red diode ring. Take a piece of aluminum foil and tape it on the skin. In this case, I didn't tape as much as I should. You'll see in a moment that the aluminum foil became a little loose. So you can be more generous with the tape, and you can actually tape further in the back onto the hair, that's okay also. And then I often put a little towel underneath it to weigh it down. In this case, I'm trying to use the patient's head to weigh the foil down, and it didn't quite work. Place the black clip of the 3 bypass cord on the pachi and spark. Touch the pachi to the foil and spark it. Then take the black clip and place it on the foil. And here I'm trying to make sure the foil is actually touching everywhere. Because it was a demonstration, I was being a little bit sloppy here. I personally find tinnitus to be quite hard to treat, and have for the most part had limited results treating it. The treatment for eyes is extremely important. It treats not just the eyes, but the whole body, and can be very important for pain, especially shoulder and neck pain. Our eyes are a major organ of perception, and pain is a perception. There are 2 treatments for eyes, one with needles, actually 2 with needles, and one with chains in the ears. I tend to prefer the chain treatment. The needle treatment, both of those use the same points. The first one uses DO20, gallbladder 1, and gallbladder 14. Gallbladder 1 can be shifting between gallbladder 1 and a little bit more towards Taiyang, and it is needled towards the eye. Gallbladder 14 is actually about halfway between UB2 and gallbladder 14, not on gallbladder 14 above the center of the eye, as the textbook describes it. This point is needled down towards the eye. If you're treating just one eye, simply create one triangle. Say the one on the patient's left side of the face in this picture. Place the clips on and spark DO20 and place the black clip on DO20. If you're treating both eyes, create 2 triangles, one on each side. In this case, the yellow triangle is on the left side and the blue triangle is on the right side. The needle on DO20 is sparked twice, one for each side, and it receives both black clips. Notice that on each side, the same point receives opposite clip than the other side. In this case, on the left side, I have gallbladder 14 with a green, and gallbladder 1 on the patient's left with a red. So that on the right side of the patient, I reverse the triangle and have gallbladder 14 carrying the red clip and gallbladder 1 carrying the green clip. This is using one triangle on each side. You can also, instead of using one triangle, one cord on each side, the same treatment points, using the same treatment points, you can use both sides at the same time with one inner triangle and one outer triangle. Here, the inner cord, the inner triangle, is in yellow. It uses DO20 and both gallbladder 14s, or rather the point between UB2 and gallbladder 14. The outer triangle, the blue cord, goes from DO20 to both sides of gallbladder 1. The same point on each side automatically receives different color clips because they're part of the same cord, the same triangle. However, you still have to make sure that you do not have the 2 red clips of the 2 different cords both on one side, and that the 2 green clips are on the other side, but that there is an even distribution. In other words, in this picture, gallbladder 1 on the patient's left side is green, and we have to make sure that gallbladder 14 is going to be red. Otherwise, we're going to get both greens on the patient's left side. Again, DO20 receives both black clips. That means you need to ensure it carries the weight of both clips, which means you may want to needle it towards the nose rather than away. This treatment produces quite a strong and uncomfortable sensation with a spark. When treating both eyes, and often if only one eye has a problem, I use the chain treatment. Using a diode chain, I fill each ear with part of the chain and tape it onto the ear so it stays inside the ear. The middle of the chain passes on the back of the head, about level of the occiput, an area that's related to sight. I connect the green clip to the chain on the side of the worst eye, and the red clip of the 3 bypass cord goes on the other ear of the not so bad eye or the perfectly good eye. I needle do 20. The black clip goes on the back of the pachi, do 20 gets sparked, and then the black clip goes on do 20. This produces a very intense sensation, kind of like an earthquake inside the brain, but it is very, very helpful, and most patients prefer this treatment over the one with the needles. I generally find it also to be more effective. These eye treatments are good for any eyesight problem, as well as glaucoma, eye socket pain, etc. For treating eyes, you can actually use one chain in each ear rather than parts of the same chain, so you can forego the going back on the occiput. However, stuffing the full chain in the ear can be difficult in smaller-eared patients. A very similar treatment is used for quick relief of migraines. You stuff the ears with part of the chain, connect a clip to it, and tape it. In this treatment, it is one chain only and should go through the occiput. You do not needle do 20 for the migraine version. You simply spark the chain on the occiput and then spark the area where the headache is on the skin, and then take the cord off and the chain off. Let's look at this eye treatment. So, take part of the chain and stuff it in the left ear. Tape the chain so it doesn't fall out of the ear. Sometimes I put the clip in, clip the chain already before I tape, but that's not always so easy. Okay? You can still get the clip in there. Bring the chain around so it touches just above the occiput. Stuff the rest of the chain into the ear. And now tape that. Make sure that the chain stays inside the ear, that it doesn't fall out. Now, we're going to assume that the right side, the right eye, is the bad eye or the worst eye. So the green clip is on the right side. Her left side gets the red clip. It's either the okay eye or the not so bad eye. The black clip goes on the back of the pachi. And we spark to 20. That produces quite the sensation, you can see, with a bit of a delayed reaction here. And the black clip goes on to 20. For any face or head issues, it is important to open up the upper thoracic spine, especially T1 to T3. So on the back, find the most congested vertebral space between T1 to T3 and needle it at 45 degrees towards the spine. Needle small intestine 11 and either gallbladder 21 or UB10. Decide according to which one feels gummy and congestive. Place the red and green clips of the 3 bypass cord on small intestine 11 and gallbladder 21 or UB10. Spark T1 to T3 needle and place the black clip on it. On the other side, you might choose a different point, for example UB10 versus gallbladder 21, than the first side. This is a 2-cord treatment. Each cord stays on its own side and does not cross because there are chest points involved here. The yellow cord is on the patient's left side and the cream cord is on the right side. Naturally, on each side, small intestine 11 and gallbladder 21 have different colors on them because they're part of the same cord. But you still need to make sure that the clips on small intestine 11 on each side are of opposite color, and that the clips on gallbladder 21 are of opposite colors also. That part you need to create yourself when you place the clips. It's not going to happen automatically. If the person has a buffalo hump, rather than needle into the tightest intervertebral space, which might be hard to find to begin with because there's puffiness over it, needle into the hump from the top downwards. Use a 40 millimeter, an 1.5 inch needle. Again, use small intestine 11 and either gallbladder 21 or UB10. You can use other upper back points for the red and green clips. For example, UB13 and small intestine 11, UB42 and Sanjiao 15, creating a triangle with those, with a black clip still being on DO14 Watteau. This treatment is basically the same as the one we just saw. It is only the needle angle on the Watteau of DO14 that is different. On this patient who has a bit of a buffalo hump, the needle was inserted downwards along the side of the spine into the hump, while in the previous one, the needle was inserted at 45 degrees towards the spine, and it probably was lower than DO14. But with a buffalo hump, you want to go at the top. Also notice that in both treatments, although it says small intestine 11 and gallbladder 21, you can make a slightly different triangle. As long as the points on T1 to T3 is the same, that's the area you want to keep constant. You can actually use, for example, UB42, which is what I used here, and you can even use small intestine 9-10. You don't have to use small intestine 9 and gallbladder 21. So you can sort of manipulate the protocol a little bit on your own. These two treatments, both of these two treatments, open up the upper thoracics and the back and the neck, and are used for head, face, and neck problems, including cervical osteoarthritis. After the treatment, I use the chain and the Hibiki 7 treatment on these patients when they're sitting up. For Bell's palsy, Kawai uses two triangles, two cords, both on the affected side. It is the affected side that is the treatment side. However, you can add 2 more cords on the good side as prevention. And if then you add a 5th cord for a Ren-Do miscommunication, because it is a face issue, you can see that you can actually have 5 different cords happening at the same time, and all in just the space of the head. The first triangle is for the lower part and consists of the chin point at the center of the chin, which is meant to equalize the muscles of the face, as well as small intestine 18 and stomach 4. Officially, small intestine 18 should receive the black clip in this treatment. I sometimes place the black clip on the chin point. The chin point became very popular with Kiiko recently to balance the face, to treat TMJ, and even for brain problems. If it balances the face, it must balance the brain. The upper triangle consists of gallbladder 14, or rather the point between UB2 and gallbladder 14, Taiyang, and stomach 7. So again, you can add a 3rd cord for the basic Ren-Do miscommunication with red and green clips on DO20 and sparking Ren-22 and placing the black clip on it. And then if you really want to go kind of wild on it, you can do the same treatment on the unaffected side as well. For colds and flus, Kawai uses his 3 wind treatment, named that way because all 3 points have the character wind in them. DO16 gets the black clip, gallbladder 20 and UB12 with red and green clips. In this treatment, because it involves a chest point, UB12, you form 2 different triangles, one on each side, with both meeting at DO16 and both black clips placed on it. It is important to also do Kyutoshin, needle moxa, on DO14 or the Watto of DO14 as well as UB12 or the Watto of UB12. I tend to do OQ, direct moxa, on these points instead. Kawai's lung treatment with a 3 bypass cord is quite similar to the neck buffalo hump treatment, as it is basically the same treatment which is about opening the upper back. It consists of Ding Chuan, that is the Watto of DO14. If the person has a buffalo hump, which is common in chronic lung problems, needle Ding Chuan down and into the hump. This needle gets the black clip. Small intestine 13 and small intestine 9-10 are the ones that get the red and green clips. Small intestine 9-10 is a point between small intestine 9 and small intestine 10. It is needled up and out towards the deltoid, and it should release tightness on the rhomboids. I often substitute and use UB42 instead of small intestine 13. This is a treatment that takes one triangle on each side, not crossing. To that treatment, add moxa on Ding Chuan, UB12 or UB42 or both, UB17 and UB20. This is Kawai's treatment for chronic cough. Although originally this is a Kyutoshin protocol, that is moxa on top of a needle, I use OQ, direct moxa, and find this treatment with direct moxa only to be very effective. You can see on the needles, at the base of the needles, there's a little red dot. That's the Shionko cream. That is the base on which I do the OQ moxa. The hemorrhoid treatment is an excellent treatment for relieving hemorrhoid pain. It is done with one cord. Before you start the treatment, ask the patient to squeeze their buttocks in order to feel the pain or the burning of the hemorrhoids. Some patients can produce that sensation by coughing. Then, after the treatment, you can ask them to do the same thing and see how the pain of the hemorrhoids is going with the treatment. It usually is extremely well. So find the gummy spot around UB35 on each side. It will be slightly more lateral than the official half tsun described in the books. The more painful or more gummy UB35 gets the green clip, and the lesser one gets the red clip. If they are the same, I tend to place the green clip on the left side, as the rectal vein tends to lean somewhat more towards the left. Then needle L5 at the center. On some people, you will actually find some varicosity there. The red and the green clips are going on UB35. In this case, the green went on the right side. The black clip goes on the back of the pachi. You spark L5 and place the black clip on L5. Come back after about 10 minutes and spark again. Let them be there another 10 minutes, spark again, then you can take the clips off and the needles off. Although this treatment does not pull the veins back in, it is extremely effective in stopping the pain. For herniated discs, needle 3 painful spots on the spine, around the disc, and connect the 3 bypass cord to them. The top needle gets the black clip and is sparked. The middle one gets the green clip, and the bottom gets the red clip. I tend to avoid this treatment because I tend to shy away from needling problematic areas. Even if I release the pressure pad on the spine with, say, spleen 9 or sacroiliac ligaments or heart of soul or whatever you might use for the spine, my preferred treatment is to tape diode rings on the problematic disc, put the red and green clips of the 3 bypass cords on the rings, cover it with aluminum foil, spark the foil, and place the black clip on the foil. We will see that treatment in a little while. For knee problems, Kawai would needle 3 fingers above spleen 10 on the liver channel, and at the same level a point on the gallbladder channel, perhaps towards the stomach line. These 2 needles will receive the red and the green clips. He then needles heading at the top of the patella, sparks it, and places the black clip on it. Both the inner and outer knee eyes are also needled and sparked. Because I shy away from needling problematic or painful areas, I use a slightly different treatment, the one shown in this picture. I needle spleen 10 or thereabouts, stomach 34 or thereabouts, and a point between stomach 31 and stomach 32 that has a strong dent or is gummy. The red and green clips go on the lower points, the spleen 10, stomach 34, and the upper, stomach 31 or 32 area is sparked and gets the black clip. This is what I call the quadricep facelift treatment, to get the quads to lift up and support the knee better. For skin problems, put Prestax on the affected area. In cases of eczema, apply Moxa on the area first, then apply Prestax. Cover the affected area with aluminum foil and tape it tightly onto the skin. Attach the red and green clips of the 3-bypass cord to the foil. Attach the black clip to the back of the pachi and spark the foil. This sparking is usually not felt by the patient at all. Occasionally, they will feel as if the foil is tingling. Place the black clip onto the foil and repeat the sparking every 10 minutes. Keep the foil on for at least 30 minutes. When you take the foil off, you can pull out the Prestax using tweezers, as they would be quite strongly stuck onto the skin by this point, or you can just leave them on and they will naturally fall off in the next few days. An extension of this treatment is the so-called facelift mask treatment. This is done for improving the tone of the skin, acne, wrinkles, etc. Place Prestax on the following points: gallbladder 14, UB2, yin tongue, gallbladder 1, gallbladder 3, stomach 7 or Taiyang, large intestine 20, small intestine 18, do 25, do 26, ren 24, stomach 4, stomach 6, the center of the chin, under the chin, and any other area where the skin requires attention. So these are not exactly, it's not as if you have to do these exact points, but you cover the face with Prestax. You'll see that in a moment in the video. Cut a sheath of aluminum foil large enough to cover the whole face, including the forehead and part of the throat. Measure it and cut a small hole for the nose so that the patient will be able to breathe while the face is covered with foil. Place the foil on the face and make sure the foil is clearly touching the skin and that the patient can breathe through the hole that you cut in the foil. I use a towel above the head and on the side, covering the ears, to help press the foil down because it's hard to tape it onto hair. Connect the red and green clips of the 3-bypass cord to the foil. Ask the patient to close their eyes. Connect the black clip of the pachi, of the 3-bypass cord to the back of the pachi, and spark the whole face over the aluminum foil. When you get close to the eyes, remind the patient to close their eyes. The patient should not feel anything, maybe a little warmth or some tingling. Place the black clip onto the foil and leave it there. Come back and spark every 10 minutes. Leave the foil on for at least 40 minutes, so that's about 4 or 5 sparkings of every 10 minutes. Take the Prestax off with a pair of tweezers and press on each point after you remove the tack. Most patients do not want to leave the needles on their face, although if they want to, they can. The skin will feel bright, smooth, and moist to the touch. A number of cosmetic skin experts have told me that this is the best treatment they have experienced. I use Dongbang Prestax. You can use the Pionex ones, but I find that it is not necessary in terms of subtlety of the feeling of the needle. I also personally prefer the Dongbangs, and in the video that we're going to see in a moment, you'll see the technique is important as you flick the needle, which you do not have to do with the Pionex. So let's look practically as to what that's going to look like. So here's the beginning, yin tang, UB2, and you see I'm just flicking the press stack on. And we're going to skip some of the rest of the face needles, because you don't have to see every needle that we put in. So this is pretty much the end. Okay, and you can see that I actually skipped large intestine 20. It wasn't really necessary there. I take the foil and I'm not putting it on yet. I'm just cutting a hole for the nose. I want to know where the nose is going to be, because she's going to be underneath there for 30 or 40 minutes. Now you take the foil and you press it tightly onto the skin. Tightly, gently, but tightly. Okay. I am going to use a towel, or in this case it's actually a blanket, to sort of weigh the foil down. So it's touching the skin well. Okay. And again, I could take the skin at the base of the throat. Probably should have done that. I place the red and green clips of the 3 bypass cord onto the aluminum foil. And you really don't have a choice in terms of placement. It has to be at the base of the throat because the rest of the foil is underneath the blanket there. Then take the black clip of the 3 bypass cord, connect it to the back of the pachi, and now spark everywhere on the skin. And you can spark, if you notice places that the skin needs more, you can spark more over them, just like you would put more press stacks over them. When you get close to the eyes, remind them to close the eyes. It's kind of important. Okay, and as you spark, you're patting the aluminum foil to make sure it really is touching the skin. Sometimes I touch it with my hand and push the foil down, just like I did there. But be aware that you might get sparked also. Sometimes when the spark comes into your hand, it's actually quite strong, whereas the patient doesn't feel it at all, but you will. Place the black clip of the pachi on, and you can spark the air. Now this one is the last sparking that I did after about 30 minutes. So you're again sparking everywhere. As you can see, the foil is coming loose. When we take it off, you'll see it. She's quite sweaty. It's quite warm underneath it. It's comfortable, but it's quite warm. Now we're taking the whole thing off. And the light is a little bit shocking. And I'm just wiping some of the sweat off her. And I'm pulling the press stacks off with tweezers. We're skipping some of these. You don't have to see me pull out every single needle, obviously. And this is pretty much the treatment. And I asked her to touch her skin and tell me what it feels like. And she says, wow, it feels so much smoother and softer. So, and that's a very typical reaction. So this is a treatment that requires some, a fair amount of handwork. And it really is worth it if you want to use the PNX needles. They are somewhat easier to use. I'm just used to doing the fast flicking, and that's why I prefer the dong bangs.